Hi, Tumnad lectures. In this video, we are looking on what we call electrocardiogram. If you find this video helpful at the end of it, please make sure you like the video, comment down in the comment section, and please subscribe. Let's go ahead and get started. So now in this video, we are mainly focusing on what we call the ECG, or what we call the electrocardiogram. The question is, what is electrocardiogram? Now, electrocardiogram is that machine which measures the electrical activities of the heart. Okay, and of course in the previous video we looked on what we call the heart conduction system. The ECG machine is going to be reading all the electrical activities running throughout what we call the heart. Now the question is, what is the significance of doing the ECG? What is the reason of doing the ECG? We do the ECG to check on the heart health. We need to understand how healthy the heart is. Okay, so now you realize the ECG is very, very, very important. Another thing is that the ECG also helps to diagnose different kind of heart conditions. We are able to diagnose different kind of the heart conditions using the ECG, like for example, the myocardial infarction. Whenever you have anything like elevated, what you call ST segment, that one can signify what you call the myocardial infarction. Okay, and even also you can do the ECG during, for example, any kind of heart surgery. Okay, whenever there is any kind of heart surgery, it is always very important to the ECG to check on the heart health in the process before you start up what you call the heart surgery. ECG tells us a lot in what you call the deflections, because the ECG machine, as it measures the electrical activities, it gives us what you call this wave pattern. Okay, these are the waves which shows a normal ECG, and if anything differs away from this kind of the arrangement, it tells us that there is a problem going on with your heart. Okay, so now these are going to be the normal deflections of what you call of the normal ECG. Now the question is, how do these waves come about? That is something which you should have to ask yourself. They come about as a result of electrical messages which is going to be moving throughout the entire myocardium to cause what we call contraction. In the previous video, we looked at what we call the automaticity of the heart. We said that the heart has that intrinsic ability to generate action potentials and spread them throughout the entire myocardium to cause what we call contraction on its own without any external effect. And we said that the SA node was responsible for initiating that kind of the action potentials that can make the heart contract 60 to 100 beats every minute, which was a normal sinus rhythm. And we say that the SA node also qualifies to be what we call a natural pacemaker. It is such another beautiful thing. So now let's go ahead and see how it reads the electrical activities, and it gives us these wave kind of deflections on the ECG monitor. That's what we are going to be mainly focusing on. Okay, now we said that the SA node was residing within the right atrium, preferably just on the entrance of what we call the superior vena cava. It has the ability to generate what we call electrical impulses, and these impulses, they will have to spread to the entire what we call the atria. The left atrium is going to be through what we call the Bachmann's band, and then to the right atrium is going to be passing through what we call the internodal pathways. Now these action potentials are going to be now depolarizing what we call the entire atrium, and it will lead into what we call the contraction. Now whenever the atria muscles are depolarized, that one also is enough for our ECG machine to give us a positive wave deflection, which we call the P wave. Okay, so now this wave here is what we call a P wave. Okay, this one here is what we call a P wave, and we have said that a P wave is going to be denoting what we call atrial depolarization. What is depolarization? Now, depolarization is when the inside of the cell becomes less negative or it becomes more positive. That's when we say a cell becomes depolarized. So now when we see a P wave on a normal ECG, it denotes what we call atrial depolarization. Okay, atrial depolarization. That's the significance of what we call the P wave. Now, when these electrical impulses move throughout what we call the atria, they don't cross to what we call the ventricles through these sides. They have to converge back on this kind of another kind of the tissue, which is among what we call the non-contractile cells, which we call the atrioventricular node. Now, this atrioventricular node, it is a slow conductor. It can hold these kind of electrical activities for approximately 0.1 second. It has that ability to delay the movement of what we call action potentials before they move down to what we call to the ventricles. And the significance of this is we are giving enough time to the atria to fully contract and push the blood to the ventricles before the ventricles contract. And we said that we also have some other kind of microscopic reasons as to why the AV node can delay the action potentials from moving from the atria to the what we call to the ventricles. We said that if you extract a small tissue in what we call the AV node, it's going to be having, those cells are going to be having less gap junction and they'll have a very small diameter. Also, that one delays these kind of action potentials of approximately for 0.1 second before they cross to what we call to the ventricles. Okay. Now, when this AV node now conducts this action potential, they will move now through what we call the bundle of His, and then they will now move to what we call to the bundle branches, both the right and then the left bundle branch, and then they move down this kind of these small kind of the fibers which you call the Purkinje fibers. Now, when the Purkinje fibers, which are deeply buried into the myocardium, they are now going to be causing the ventricular myocardium to depolarize. And once they depolarize, the ECG machine gives us three kind of the waves. It gives us what we call a QRS complex. Okay, it gives us what we call a QRS complex. It gives us what we call a QRS complex. And this kind of the QRS complex, it denotes what we call ventricular depolarization. Okay, so now this QRS complex, it tells us that the ventricles are now depolarized. Okay, it tells us what we call ventricular depolarization. Okay. Now, when the ventricles are fully depolarized, now they are going to be contracting and they eject the blood to their respective places. But of course, now after the ventricles have contracted, now it is now their turn to undergo what we call the relaxation. And when they go into relaxation, we say the ventricles are going to be repolarizing. Okay, and whenever ventricles are under repolarization phase, our ECG machine also gives us a positive deflection, and this kind of the positive deflection is what we call a T wave. You see this kind of this deflection here. This deflection here is what we call a T wave. And a T wave is going to be denoting what we call ventricular repolarization. Okay, it's going to be denoting what we call ventricular repolarization. Okay, ventricular repolarization. So now these are the parts of the normal ECG. It is going to be having what we call a P wave. It's going to be having what we call a QRS wave, or what we call the QRS complex, and even also what we call a T wave. Okay, so now this is the normal parts of what we call the ECG. Now, in the next video, we are going to go ahead and see why is a P wave a positive deflection, and why is a Q wave a negative deflection, and the S wave negative deflection, R wave positive deflection, and the T wave positive deflection. We shall even go ahead and see what do we mean when we say positive deflection, and what do we mean when we say a negative deflection. We shall go and see that one all in great detail. Thank you very much for watching, and if you think whatever I've just talked is making sense, is adding to you, you are benefiting, please hit the like button, comment down in the comment section, and please subscribe. As always, Tumnad, until we meet next time.